So I'm just going to start over here in your right ear. Just get this all set up here. Alright, almost there. Perfect. Now coming over to your left ear. Okay. Almost there. Just get that in there. Excellent. Okay, so now I should be able to hear everything that you can hear. It's new and very advanced technology that we use here at the ear clinic. So just grab my clipboard here. Okay, so I would like to welcome you here to the ear clinic. My name is Veda. I'm a doctor here, and I just need to ask you a few questions before we get started. I have your name. Can you confirm your date of birth for me? Okay. And were you referred here by your doctor, primary care physician? That's totally fine. Yeah, you don't have to be. And can you tell me the reason for your visit today? Generally, it's having to do with the ears. Okay, yeah, so we have some hearing loss. Now, is that things sounding muffled or other distortions? Muffled hearing, okay. Any itchiness, pain? A little itchy, okay. And have you had problems with earwax in the past? Have you ever had this issue happen before? No, okay. Do you tend to have more wet or dry earwax? Okay. Yeah. Any other symptoms with the ears? Okay. And have you tried any remedies at home? There's Q-tips. Okay. Are you going in the ear canal with the Q-tip? Okay, good. Good. That's what I like to hear. All right. Yeah, we definitely don't want to do that because we can cause more harm, and especially if you have an earwax buildup, we can impact a blockage in there. So that's very good. Any eardrops or anything? No. Okay. Okay. Have you been swimming or anything recently? Okay. Yeah. And when did this come on? Okay. Yeah. Have you tried anything else to alleviate the symptoms? Okay. So what I'm going to do next is I'm going to put some gloves on, and I will take a look in your ears and see what we have going on, okay? Get some gloves on. Generally, we can clear this up here in the office. We might need to send you home with medicated eardrops or something, but we'll see what's going on in there, okay? I'm just glad that you're not experiencing a lot of pain. All right. So let me just get in here. So I'm going to take a look at your left ear first. This time, left ear. Okay. Just looking here in your left ear to start, and I am seeing quite a buildup of earwax in here. I actually can't even see the eardrum because of that wax buildup. Also some redness in your ear canal. Looks like quite a bit of irritation. Yeah, I think that's definitely the cause of the issue you're seeing. Right, and your right ear. Yeah, same thing over here. Big wax buildup, redness. Still can't see the eardrum. Good thing is no foreign matter as far as I can see, so no cotton from Q-tips, which is great. Looks like it's just your own earwax. Okay. So today I want to go in and remove that earwax. That buildup seems to be the cause of your hearing issues and the itchiness that you're experiencing. I do see some redness in the ear canal, which is indicative of irritation, and that's probably because of what you've been doing to try to treat that earwax. Maybe even just getting in there and itching if you can, because I understand it's uncomfortable. Not seeing any foreign matter, so that is good. So today we'll just go in and remove that earwax, get you all cleaned out, and if necessary, I'll give you some medicated drops to treat that irritation, okay? Awesome. So the first thing I'm going to do, I'm going to just get in there with a little bit of my equipment. I'm going to start with this little loop, and I'm going to try to get just as much of that earwax out as I can. I'll be using some different stuff. I have some of these tools. I have these swabs, which, though we say do not use these at home, they're good for me to kind of get in there and maybe get a sample, see what we're dealing with. And then I have some ointment we can use to soften anything to get it out, okay? If I need to, I can bring in some suction. Hopefully we won't need to with you. All right. So to start, I'm just going to come in on your left ear again. And I'm going to work on kind of picking in your ear, okay? All right. All right. Just trying to get some of that wax out. And I'll just wipe some of that over here. Alright. That's good. It is coming out. One thing you really have to be careful of is to not push it in any deeper while we're working on it. You definitely don't want to push it in any deeper, because then it just impacts it and it's harder to remove. It is a bit wet and sticky, which is normal. So we'll just make sure to get as much of that out as possible. Okay, I'm going to switch to your other ear. I like to switch back and forth as I'm going so that one ear doesn't get too sensitive. Can kind of let it rest a little bit between switches, so do that. And I'm so sorry about the noise today. There's a lot of loud cars going by. I think it's because of the nice weather. They're all out. Okay, go to this here. Okay. Same type of thing over here. We're definitely getting out that earwax. Just good. Very good. It's actually coming out quite a bit easier than I thought it would, so that's good. Do you have any fun plans for the rest of the day? Yeah, that's nice. Anything good going on this weekend? Oh, fun. Yeah, I was thinking about going to that. My husband really likes beer, so I thought about going to the festival, and they have cider too, which I like a lot. Do you know if it's pet friendly? Oh, cool. Oh, nice. How old is your dog? Oh. How long have you had them? Yeah. Oh, that's great. That's a really nice organization. We actually, the ear clinic actually donates to them every year because they do this walk. I don't know if you've ever been a part of it. They're 5K. Yeah. So that's looking good so far. Let me just clean this off. I'm gonna grab a different tool. And this is sort of like a little scoop. And I'm gonna work on your left ear again, okay? That's good. Let me know if anything is uncomfortable, okay? Thank you. Alright. Yeah. Actually seems like your hearing is starting to improve a little bit based on what I can hear. Is that right? Good. Okay. We'll do a little hearing test at the end of this. Just to see. Looking really, really good. We're about halfway through. After this round, I am going to use some drops just to loosen up what's still in there, okay? Alright, and back to the right ear. Get this all cleaned off. Yeah, it's funny. You wouldn't imagine what we've pulled out of ears. It's so funny, especially with little kids, because you know, just they don't know any better sometimes. And part of exploring the world, I guess. Good thing ear canals are really tiny, so not too much they can get in there, but definitely have some fun stuff. We work with all ages. Okay. We do ear cleaning. We do treatment for hearing loss, fittings for hearing aids. We do hearing tests, all kinds of stuff. Have you had a hearing test recently? Oh, it's been a while. Well, we can schedule one for you if you'd like after this appointment. That's totally up to you. Okay. So now I'm going to come in with some drops, okay? So these shouldn't be uncomfortable at all. They're just a little bit cool. It's just a drop to soften some of that earwax, okay? Very good. Okay. And we'll do the other ear. Alright. So I'm just going to let that sit for a second. And while I do that, do you have any family history of hearing issues or hearing loss? Yeah, okay. Is that mother's side or father's side? Mother's. And does she wear a hearing aid? Yeah, okay. At what age did she have to start wearing a hearing aid? Yeah. Well, that's pretty typical. At least it didn't onset extremely young, in which case we might want to check your hearing more frequently. So, and prior to this issue, had you had any hearing issues? Okay, good. All right. Okay. Just gonna take a look in again to see how that's working, okay? I think that's the brakes of a bus outside. I think maybe you could hear that a little bit based on what I can hear. Alright. Yeah, we've made quite a bit of progress. I like how that looks, and I like how our drops are working, so That's good. And your right side. Also looking really good. It's good because the areas that I'm uncovering don't seem to have an extreme amount of redness, so it doesn't look like anything infectious. That looks good. Okay. Alright. I'm just gonna come right back in, continue with the scraping that I've done. Okay. Switch this out. Okay, there we go. That is just coming out in big clumps now. That's exactly what I like to see. Good. If this is something that starts happening to you more frequently, we can also prescribe some ear drops that will keep it from building up like this. Might just be a one-time thing though. Okay. And your right ear. Okay. Getting really close to the eardrum, so I'm just gonna want to be nice and careful with this. I do not want to really pick at your eardrum because it's so sensitive. I don't want to make you uncomfortable, so we'll be really, really nice and careful, okay? Alright. Good. Okay, just clean that off again. And we're almost there. Really just some stuff right around the eardrum. So I'm gonna get in. I'm gonna very, very, very lightly scrape just on your eardrum. It should not be painful at all. Just let me know, okay? Get nice and deep in here for this one. Just get deep in here. Just a little scrape. Scrape, 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 scrape. Light scraping. Very light scraping, okay? That looks fabulous. Okay. Very careful in there. Okay. I like how that looks. Okay. On this side, clean this off. And same thing on your right side. Just get nice and deep in there very carefully. Just gonna get in there to your eardrum and get the remainder off. Kind of sticks to it because it is sort of a wet, sticky wax. So we'll just make sure we're very, very careful to get that off. Okay. Yeah. That looks really, really good. Okay. I'm gonna just take a look. A nice bright light. See what we have in here. Okay. Oh, that looks much, much better. And it sounds to me like you can hear better. Does it sound a lot better to you? Awesome. Okay. Good. And this side. That is great. Okay. Yeah, so we were able to remove that blockage. That looks really good. I am going to test your earwax just to make sure that there isn't anything bacterial in there, but it really doesn't seem to be to me. And that irritation seems very minor now that we've gotten all the wax out of the way. So I am going to go in and just very, very lightly swab near your eardrum to get another sample to test, okay? So we'll do this ear first. Left ear. very light swabbing. Okay, that should be good. Get that ready for the file, and then right ear, different swab. Okay, get in here. Very light swabbing of your ear canal and eardrum. Just making sure we don't have a bacterial infection at all. Okay. Excellent. Alright. There. Okay, so I'm going to send those to the lab. We should get results in 3 to 5 days. I don't anticipate there being any issue, but if there is, we can call in a medicated eardrop prescription to your local pharmacy. Just so that I have the information on file, what is the name of the pharmacy that you use? Okay. And the location of that one? Okay. And I'll speak to you on the phone before I call anything in, just to let you know what's going on and how the treatment will be, but I don't expect that to be an issue. So let me just do a couple of brief hearing tests to make sure that everything is okay before I let you go. Can I ask you to close your eyes for a moment, please? Thank you. And I'm going to be making noise in either ear. Just let me know where you hear it, okay? Good. 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 Okay. And I'm going to be saying some numbers to you in other ear. Just repeat them to me. You can open your eyes. Okay. 52, 19, 465. Good. 86, 72, 3000. Good. 81, 42, 56. Good. 13, 112, 92. Very good. 18, 34, 12. Good. 46, 17, 22. Very good. Okay. Does everything sound normal to you right now? Perfect. That's what I like to hear. So at this point, your ears are all clear. I don't think we need any ointment drops for the irritation. I anticipate for that to go away on its own in a day or two. And we will be in touch in 3 to 5 days to let you know about the results of that test, okay? Perfect. If you would like to, on the way out, you can go ahead and schedule a hearing test for the future. That's totally up to you. But everything for now should be okay. I'll be in touch very soon. Do you have any questions for me before I let you go? Okay, well, in that case, thank you so much for coming into the ear clinic. My name was Dr. Veda, and it was very nice meeting you today.